your name?
Today is a great opportunity. It is deliberately an attempt to shape our future together.
We've chosen as an organisation to take 5 days across the patch to go into different locations that really are where we're delivering services across the county, because we want to get as many people across the organisation talking about what they're doing, sharing experiences and really thinking about that future together.
The future is not like the Isle of Man or the North Pole, a destination awaiting our arrival. The future is like the Forth Road Bridge or the Sydney Opera House or the Great Western Railway, something we imagine, design, plan and build. So shaping is a really good word. It's not coming to us, it's something we've got to make.
What do we all want to do to improve the quality of patient care? So there's going to be lots of opportunities for you to get involved, to find out stuff about the Trust, what it's been doing, but also to shape what we do in the future.
So a heck of a lot of learning going on and lots of partnership working with other people. Designing Strategy Week, we built on some of the work we've been doing in the Trust on brain-based learning, because we know that getting people involved really makes such a difference to people's feeling of engagement, and it gives us much better outcomes.
And in your packs, you've got these to-do lists. This week is a real chance for staff to have their say. And for me, that makes my life easier, because if staff really understand where they're going, then it helps me enable them to get there.
So if I can ask a couple of people from each table to come up and write on the boards, there's pens at the bottom of the boards, there are your ideas, your thoughts of how we can make a difference.
Just seeing how many people you got in one room, all wanting to engage in this piece of work with you, and they used Slido and their top word was working together, and that summed it up. 150 people right there on a Monday morning engaging in the Trust strategy.
So being ambitious for our organisation is important to us. We want to be a leading provider of outstanding compassionate care, so we need the best people to come and talk to us this week.
The calibre of the external speakers at this conference for the 5 days, for me, is inspirational.
I think we've been for a real treat.
So as it's the beginning of your strategy week and I've been asked to talk about new models of care, I was going to do that within the context of strategy and how to create good strategies in healthcare organisations, and that's where I want to start.
We had a really interesting talk on our first day on Monday around strategy and around new care models, which is so important for NHFT looking forward into the future.
And you start by understanding the needs of your population. And in Northamptonshire, like most other places in England, and not just England, the world, you have hugely variable needs and a lot of concentration in a smaller group of people. And they're the people that you've got to wrap around effectively and wrap your new model of care around.
A really fantastic keynote speech that we had from Hannah Farrar really gave clarity to accountable care organisations, and I thought summarised really well how we build strategy and what it means for us and our patients.
For it to be truly transformation, you need alignment of a heck of a lot of resource, management time and leadership behind it.
She actually explained and highlighted the difficulties that we are working under, and in order to make a success of the STP that we are all involved in, it's the key things that are required for that is the enabling bits.
One thing that we have seen through our work is no matter how you do it, there are a set of enablers which are critical for being successful. Enablers are barriers if you don't address them, and so think about them. Think about what's the information requirement, what estate do you need, how are you going to develop your workforce, what partnerships do you need in order to be successful.
I'm hoping to take this back to the team and to the higher management as well. Every one of them can then identify the enabling factors that are required to make this a success for the county.
Hello. Professor Michael West's session was really exciting. This is a fundamental paradox, that we have a sector that's focused on promoting the health and well-being of people in the community, but in the process of doing that, we're damaging the health and well-being of the people we ask to deliver that care.
Listening to Professor Michael West's speech this morning as part of the Soft Week was extraordinarily inspirational, really, really interesting for me as a senior manager within the Trust.
He's probably the leading academic looking at staff engagement across the health service. He's done a number of academic studies and really highlighted how
great staff engagement and involvement and really good HR practice and leadership is very much associated with improved quality and improved quality of care.
We also know that it has an impact on the quality of care that we're able to deliver. It affects error rates. We have to ensure that compassionate leadership is practiced not just in provider trusts, but at every level of leadership across the sector, in order that we create cultures of high quality, continually improving and compassionate care. Leaders play a particularly powerful role. What you as leaders pay attention to, what you monitor, what you talk about, what you reward, what you model, tells everybody in the organisation what it is that you value, what's important to you.
As a board, you know, we can't sit there and make everything happen on the ground, but what we can do is create the sort of great place to work that staff feel valued, they feel empowered, and then they can really make a difference to the service users and patients that we have.
And linking compassionate leadership with the level of care and the type of care and the compassionate care that we deliver through our services and through our teams, I think it's an extraordinarily powerful view, and I could see it resonating with lots of people in the room.
I think anyone can see that that means when they see patients, they're in a much better place to deliver that quality of care, respond to patients, to be flexible.
The trouble with healthcare is the more healthcare we do, the more harm we do. The more healthcare we do, the more harm we do.
Muir Grey was quite powerful today.
There reaches a point where as you put more resources in, subtract the harm from the benefits, and it starts to go down. Overuse of healthcare.
He's just a very, very engaging speaker.
For me, the quote that I take back from Muir Grey is that anything that doesn't add value is a waste of time.
Joint replacement, hip replacement, knee replacement. The wonderful operation of the 20th century, but are we now doing it too soon to people? Are the numbers are keep going up. Imaging, CT scanning and X-ray are going up to 10% a year. All of high quality, but what's the value of that? What's the value of the last 10% of increase in imaging? And this is quite simple stuff I was talking about. Focus on the population, focus on value, develop systems and get a good culture, collaborative culture, focus on stewardship. Low quality care is low value, but high quality care need not be high value.
I found Muir Grey really, really inspiring. I think he put really simply some of the biggest challenges in healthcare. And I think one of the things that really hit home to me was about the importance of doing something, but sometimes not doing too much. And I think the discussion which came afterwards showed that we were able to pick up things where we could recognise that we were doing too much. In actual fact, if we stopped doing those, we'd have more time and more resources to focus on the things we need to do more of. And it ties into the fact that in some places 75% of people die in hospital and other places 45%. Because when you're admitted to hospital, then things start to happen to you. And they may be high quality, but these are things that happen. I reckon we spent £1 billion in the last year of life doing more harm than good.
Now, what is value in terms of, is this adding value to the patient? And his example of somebody who had a knee operation, who had more pain after the knee operation than before the knee operation, where's the value in that?
So we've got a new agenda now, and this is the new word. You people who are running the health service in 2027 and 2037, the word is value. Now, value is a very tricky word. When I was talking about the word value, and then we'll follow up with giving people examples of the word value, that starts people thinking in a new way. So I was just very impressed with people who came up from every sector of the organisation and said, yeah, more of the same is not the answer. We've got to think in a new way. At the back, you're sitting very nicely, quietly there, so...
I think engaging with the keynote speaker was really important today. That allowed us to have a bridge between his knowledge and his expertise and the people on the ground.
Okay.
I just remind you about the colouring at the back of the room, for anybody that wants a mindful break.
Over the days, we've had a great opportunity to do Digby Q Live. What that's meant is really sharing what services, leaders across the Trust have been doing to put Digby Q Live in action. All of that live events has been a chance for people to showcase what they've been doing against that strategic plan.
The main bit of this is going to be about the local digital roadmap.
And this is where the brain-based learning in particular comes in.
It's been fantastic. I cannot tell you enough about what it's meant to people to hear what others are doing, to understand actually it's real, it's making a difference for people and it's improving outcomes. So it's been a great chance to share across the organisation.
All of us, the way our brains work, the sympathetic nervous system kicks in if we're worried and scared.
We've got the Q, which if you didn't know already stands for quality in the Digby Q. So we're representing children's services and we're in the next 7 minutes going to demonstrate to you how we deliver quality within children's services in NHFT.
My favourite one was probably the neural modulation talk. I think that was I.
Transcranial magnetic stimulation is where we take a very strong magnet and we apply it to a certain part of the brain and we stimulate the underlying brain with the idea of trying to increase the connectivity of the network that's involved in depression. So I was asked to head up the innovation part of the Digby Q in the morning sessions. We got very, very good feedback. I mean, people were interested in how can I refer people. We got a round of applause often. People were very engaged in what we were saying.
We're talking about building a sustainable organisation today as part of the Digby Q session. Today I was presenting about the work the Trust's been doing with e-systems, particularly focusing on workforce systems. So at the core of this for NHFT is our electronic staff record. It was to tell everybody about the electronic staff record and all the systems that feed into it that allow us to plan our staff, make sure they've got the right skills to do their job and pay them, hopefully correctly. It's often rare that we get good feedback, to be honest. It's normally the negatives that come, but today we had some good feedback about the systems and that staff are really glad to see that we're working to make the systems easier for them to use.
Individually, look at these three. Can you work any out? Relaxed, not awareness. Relaxed alertness.
You could wait 2 weeks to see a physiotherapist, or you could wait 8 to 20 weeks to see a physiotherapist. And you have a patient who's now gone into a chronic phase, the symptoms become more chronic, you have an unhappy patient, you have an unhappy GP, the whole system is unhappy. The workshop that I did was to show collaborative working with our GP partners and to highlight how MSK physiotherapy can be valuable in urgent care hubs. They identified that one of the groups that they do see a lot of is a musculoskeletal, so they wanted a musculoskeletal specialist on their team as well. We took a traditional pathway of referral into physiotherapy and turned it around to show that having physiotherapists assessing patients in primary care, sitting alongside GPs in their practices, seeing the patient as first contact practitioners helps and is more effective in reducing chronicity of long-term conditions. They realize now that the MSK patients need to be seen by MSK specialists.
For me, it's real examples of how we've made a difference and how we've improved things for our patients, but also actually done things more efficiently. So it's a sort of win-win scenario, and I think hearing those examples is fantastic.
So you might be saying to me, okay Diana, what am I doing here, sitting here and standing here? Equality again, what's it got to do with me? We're not talking about this subject again. I mean, what's it mean for the NHS?
I want to be posting a lot more jobs on Facebook, Twitter, LinkedIn, Instagram. Well, I need your help.
Because you do that now, which is why you're good. So what ideas have you got to make that outstanding?
You get people thinking differently, put a different way of thinking, a spin on things. They bring their unique skills, their ways of doing things. So diversity can enrich your team.
Thanks very much everybody. My name's Phil Terry, I'm an inspection manager with the Care Quality Commission. What really helps us is if you are able to tell us why you know you are safe, why you know you're delivering the best possible care for your patients. And rather than leaving it on the day when I come to inspection and go, how do you know you're good?
Having this type of showcases are important in that we get to learn what is happening around the trust and what pilot schemes and what good collaborative working we are all involved in.
I think probably like many of my colleagues, I'd seen the Digby Q in print, but I think to see the range of projects and the things that have come out of them is, I think that's what I need to be sharing.
The public should feel reassured by CQC, even though you see a lot of them don't know who CQC are.
I understood that funding sort of had stopped.
Is there a likelihood that most of the GP surgeries are going to move from EMIS to System 1?
Some of the feedback from members of staff saying, actually, I didn't know about that. It was really worthwhile me coming for that reason. That probably was the highlight for me, I think.
Can I ask everybody that's got a sticker with 50 on to come and stand at the front, please?
We've also had a chance to look at the future of our population.
20% of our county are children.
Fantastic interactive experience. I think it's made us all laugh. We've used people across the trust to illustrate our population, and we've took some time to think about how that population is going to change.
There's been a 25% increase in adult social care support.
We've looked at conditions, we've looked at life expectancy, we've looked at the age groups, we've looked at carers. All the different things that affect our population and how we're going to have to respond to that as an organisation.
Using the sashes, whoever thought of it was very clever, because it actually demonstrated the complexity of health.
30% of our county have long-term conditions, and that's whoever's got the gold.
Most patients present not with one thing, but a whole range of issues affecting their life, or a whole range of conditions.
So one of the sessions the other day, somebody finished up with 9 sashes, 9 different colours, and actually to think about the complexity of that individual's health and how we need to take the information from the presentation back into clinical services. With a 9% growth in population by 2024, how are we going to change our services to make sure we deliver the outcomes of our patients?
Just a bit of context to get you thinking about the challenges of our county into the next 5 to 10 years.
Shaping our future today has increased my awareness of things that are going on in the trust. The leadership days always do, but this in particular, meeting new people, seeing different services, and just seeing the extent of the way in which people are developing, innovating and growing it's just amazing. And there's a real buzz and I think a real desire to move forward.
Highlight of the day for me has been the passion that everybody's shown and the innovation and seeing the ideas that people have and how they're determined they are to make them work.
The highlight of the day for me was really feeling the energy in the room and getting the feedback from people of what they'd taken away from it and really how they wanted to do something different as an outcome.
You know, anticipating vacancies is absolutely critical.
Just the terrific opportunity to get to meet people from across all services I've met and shared ideas with people from finance, with people from dementia services, with learning disability services, mental health services. I think just that diversity has been terrific for me. Yeah.
Well, the highlight for me of these events is always meeting individual staff, but also having a sense of the real commitment of those staff, of all of the staff who are here, to delivering high quality care for people in their communities, of ensuring that they're delivering continually improving care, and of this commitment to compassionate care. So that's a real highlight, but also a sense of the courage of the Trust in committing to these events over a week in order to really transform the health and well-being, ultimately, of patients, service users and members of the community.
I enjoyed chatting to people. That's always the best bit. And for me, when you talk to 2 or 3 people, you sort of get an moment where you think, yeah, I need to understand that a bit more. And also my contact book gets a little bit bigger, so that the next time I'm in one of your hospitals or maybe one of your health clinics, I'll know somebody. I'll say, hi, how are you doing? And you can have a chat. And that means it makes it more real when you're talking to people about the patients they see and the challenges they face and what they're trying to do to overcome them.
We spend a huge amount of time looking at national press. We talk to our colleagues in our partner organisations about how we can change things for Northamptonshire. But actually it's having that sort of levelling, is that right? Are we doing the right things? Are there massive things that we're missing? So by having an opportunity to speak to so many different people from varying backgrounds, not just if they're working in the services, but people that are actually service users themselves, are we going the right way? And to me, it's absolutely important. We have to listen to what our staff are saying, otherwise we won't achieve anything.
I think it's become apparent from listening to the keynote speakers that things are going to change. I think that one of the vital messages we can take away and a highlight actually is looking that we're aiming really high, but that we can actually achieve it.
As a trust, we have a huge amount of skill and knowledge in a wide variety of areas, and we should be shouting that out so that we can show how good we are and what we can do and achieve as a team, as Team NHFT.
We need to consider the needs of our population as well really closely. And I think from today I've seen things and heard things that I hadn't considered, and certainly that's something that I'm going to look to integrate into my practice.
Suggesting that our 5 days are a road trip, I think for all of us who've been here each day, there's been an element of that, but it's been a great road trip. It's been great to see all the staff. It's been great to be in all the locations across the county. I think there is an element of it being a numbers game. If we've had 600 staff involved, if they all talk to 3 or 4 staff, and if they're 3 or 4 different staff, that means potentially the whole organisation is engaged in the discussions we've had, in thinking about our strategy, in how we're shaping the future. And I think that really marks us out as a special organisation that, you know, we, because of our ambition and what we're trying to do, and because of the way staff get involved, and you see it on the day, people are up, talking, asking questions, that actually we start to create that dialogue that we can have some confidence is spread across the organisation. And as we get more ownership and understanding across the organisation, I think that engagement of staff just brings better outcomes.
I think most people, when they see the challenges facing the NHS, think initially of money. But actually this challenge of staffing is much harder than money. Money doesn't actually make people well. You need to convert it into something and make it into something that people need and can value. So when we think about the fact that a patient doesn't turn up with one issue, they've maybe got 3 or 4 issues, and maybe not just one of them goes to NHFT, but maybe 2 of those are with Northamptonshire Healthcare. Maybe one's with social services and one was with the acute hospitals. It understands about collective working, and it also understands that people are individuals and not a herd. So it's not mental health, it's somebody who has bipolar who's maybe looking to get pregnant, and how do we meet their needs?
I think today has been brilliant. It really made me proud to be part of such a compassionate organisation that's really focused on making sure the leadership is right.
If I had to sum up the day, the event, in one word, it would be compassion.
I'd say inspirational.
Collaboration.
If I had to sum up the week in one word, the word would be involvement.
Enthusiastic.
I would definitely say it was exciting.
It's been inspiring.
For me, it's inclusion.
From my point of view, it's been exhilarating.
Can I use 2 words to sum up the day? I think it's all been about working together.
I'd say collaboration for success.
I'd use 2 words. I'd say amazing and fantastic.
It would be creative. Creating the future, shaping the future, not letting it come towards us.
So if I could sum today up in one word, it would be 2. It would be proud and pride.
Hopeful. We've got a chance for the future.